in localized prostate cancer, there's been some exciting changes. I mean, I think that we are using prostate MRI and PSMA PET scans, which could be with CT or with MRI. And this is allowing for the detection of prostate cancer more sensitively or more accurately. And so people are using these imaging modalities, MRI and PSMA PET scans, to essentially see where there are suspicious tumors or areas that we think are tumors within the prostate. Is there any evidence that there's cancer outside of the prostate? So with the MRI, for example, if you have a lymph node that is enlarged, or you see a tumor that's coming outside of the prostate and growing into the adjacent seminal vesicles, in the past we wouldn't have that data, but now we see, and that may affect whether or not someone should get surgery or just get a radiation up front. And if you actually think that they're in lymph nodes or outside the body, you may treat them with chemotherapy, whereas you may have just had surgery before. So it's making staging more accurate and giving treatment more accurately to people who would benefit from treatment. So if we think it's local and there's cancer outside, it probably isn't the best treatment. So PSMA PET scans and prostate MRIs are helping to give the right treatment at the right time to the right patient. That's exciting. And it helps with staging and treatment choices. What the long-term implications of those, we don't know yet because it's going to take more time to get that data. 5-10 years will be early, but prostate cancer kills in 10 to 20 year horizon. And so oftentimes we need a lot of time to get really meaningful data about whether or not our changing our strategies actually is helping patients or not. So for localized disease, for metastatic disease or advanced disease, these same two imaging modalities are now allowing people to be, again, more accurately staged. So that in the past, with a bone scan and a CAT scan, we may not have seen some of these lymph nodes that are outside of the pelvis light up, or these little bone metastases that were small may not light up on a traditional bone scan or CAT scan, but now we're seeing them light up. And so people who we thought were going to be, only had one metastatic site may have had multiple metastatic sites, and it changes the aggressiveness with which you treat them. It also provided an opportunity with PSMA PET imaging to do lutetium-based kind of treatments where you link the PSMA antibody to some radioactive compound so that this radiation can be delivered to the site of metastasis directly. And it's a way to kind of treat people with advanced metastatic prostate cancer, usually castrate-resistant prostate cancer, and you get another chance to kind of suppress their tumor load, tumor burden, and give them another round of treatment before they would be all out of options.